Assalamu alaikum, Bismillah Rahman Rahim. Today we will talk about a very important point, the exposure of the patient. Always tell the examiner that I need to have a full exposure for the proper examination of the patient. For example, if the command is to examine the abdomen of this patient, do the relevant. So you will say to the examiner that I need to properly expose the patient from the nipple up to the thighs, and then the examiner will say that okay, you can do the minimum exposure of this patient. Now if the command is to examine the chest of this patient, then you will say to the examiner, sir, that for a proper exposure I need to expose the patient. Then you will say to the examiner, sir, that for a proper examination I need to expose the patient, or I need to take the shirt off for the proper examination. Then the examiner will say that's okay, you can do the minimum exposure. In the female patient, always say that I need a chaperone for the proper examination and proper exposure of this patient. And examiner in Pakistan will always say that you can do the minimum examination. And if you have any problems during the auscultation of this patient, or you cannot do the auscultation over the shirt, then you can put the stethoscope under the shirt of this patient, under the shirt of the female patient, keeping the dignity and exposure of this patient in mind. Always keep concentration on the proper exposure of the patient. Never go and start examination not properly exposing the patient. And always remember to re-drape the patient. It has the separate marks. Re-drape the patient after the examination of the patient. And another important point is that always keep a sheet with yourself in the exam, and you can if after taking the shirt off, you can put the sheet on the overly exposed parts. It puts a very good impression in the exam. So these are very important points. Thank you.